Hello, everyone. I am Kircik. I am a clinical professor of dermatology at Icahn School of Medicine at Mount Sinai in New York City. I also have my private practice and a clinical study center in Louisville, Kentucky. Today, I'm really excited to discuss isotretinoin, but mostly on Absorica LD. So I've been closely involved. Actually, we have done a Absorica LD study, the investigator-initiated study with Dr. Jim Del Rosso in Nevada and myself in my office. And I do want to discuss a little bit about the background of going back to original isotretinoin, right? It's the miracle drug for acne, and what were the problems with the drug, especially with the bioavailability, right? Originally with the isotretinoin, we had to take it with a meal, with food stomach, with really, actually, I should say, fatty meals. Now, imagine you're taking a drug with fatty meals, but the drug itself has adverse event profile with increased triglycerides. Isn't that ironic? So that was the original problem with isotretinoin. And if you think about it, going back and thinking about bioavailability of a drug, there are a couple of issues, right? You have permeability, you have solubility, and you have dissolution. The dissolution is directly related to the particle size of the drug, which basically you can make it micronize, and that's where the Absorica LD comes in. The solubility has something to do with the how you can dissolve the molecule in a fatty environment, and that's where the Absorica came actually with the new formulation lipid envelope. And of course, the permeability is isotretinoin itself is permeable. So that's sort of the history of the drug when the first generation isotretinoin and then came with the generics. The second generation was the Absorica, which is the light dose formulation that lessened the meal requirement. The light dose formulation is nothing new to isotretinoin itself. It has been used overall with the lipid matrix in other drugs, but it came to dermatology with the isotretinoin. And then finally, we have the third generation isotretinoin, Absorica LD, which is the micronization technology, increasing the dissolution, and with the lipid encapsulation, which increased the solubility without eating these big meals. So that's where the problem was. What happens if you take the right dose, but the medicine is not absorbed appropriately, right? When you look at the retreatment rates, actually is pretty high. There are a couple of different studies. One is by Layton and Al in 1993. And when they looked at the different dosage from 0.5 milligram per kilogram to 1 milligram per kilogram per day, it's almost 22 to 39% retreatment rates. Another study comes from Conliffe and colleagues, old one, 1987, depending on the dose again, on the 0.5 milligram per kilogram was about 40%. And those are because most likely people did not reach the target cumulative dose and ended up with relapse. So that's the problem with the isotretinoin and the formulation. So Absorica LD, now actually it did enhance the bioavailability of the drug. First of all, it is encapsulated with the lipid matrix, but by reducing the particle size by micronization, it improves solubility and improves the rates of the dissolution. And this is very important. And this is how you can reach that ideal cumulative dose without eating big meals and fatty meals. I think that's where the trick is. What does micronization do? It basically maximizes the absorption of that particular drug in low dose formulation, right? It's the physically processing, reducing the drug particles to micrometer size, and it increases the rate of the drug dissolution, and also substantially increases the surface area of the drug per particle compared to other drugs compared to the same drug in different size, in different formulations. So in this case, Absorica LD actually demonstrated twice the plasma levels of regular isotretinoin compared with the Absorica capsules in the fasted state. So this is a tricky word. Again, the key word is the fasted state, right? The Absorica LD doses come in different doses. You can have 8 milligram, 16 milligram, 24 or 32 milligram. Basically, it's 20% less than the regular Absorica dose. Concentration, peak plasma concentration of the drug, of the regular isotretinoin without the lipid encapsulation, without the micronization. In the fast state, it's about 37% for 40 milligram. It's about 74% for regular Absorica at 40 milligram. And then it's 94% for Absorica LD at the 32 milligram dose, which is a 20% less dose, right? That's the key. Now, the other thing I do want to mention, because this is close to my heart, we did this study with Dr. Del Rosso in his office in Nevada, as well as in Louisville in my office, and we looked at the micronized isotretinoin dose once a daily without food in patients with recalcitrant nodular acne. This is the only one actually that was done. This was supported by Sun Pharma at the time. And when you look at those numbers, you can see that average nodule number was about 6, and that went down to 0 at week 12, and then continued to be 0 at week 24. And then when you look at the patients achieving clear, almost clear, was about 96% at week 24. We looked at those patients 24 weeks, 6 months. So basically here, Absorica LD has 20% less dosing and 2 times higher the peak plasma level of the drug in a fasted state, which is the ideal state, especially for teenagers who don't have breakfast, right? And also in my study, we did have quite a bit of skin of color patients, and we saw that the drug works equally well in all types of skin, in both teenagers and adults, as well as males and females. So we did not see any difference among subgroups.